following podcast is brought to you by Kidney Stone Prevention Clinic of Orlando. Dr. Paul, welcome back.
Hey, Will. Thanks for having me.
So good to see you again. We want to thank you, the listener, for tuning in. And as always, the doctor will see you now. Dr. Paul, since this is a kidney stone prevention podcast, let's start talking to the good folks about kidney stones themselves, right? And Dr. Paul, most kidney stones contain calcium. Are there other types of kidney stones?
Yes, Will, there are. So, as you said, most common are calcium-containing stones, calcium oxalate, calcium phosphate. But there's several other stones, make up maybe 10% of total stones. There's uric acid stones. There are staghorn stones, also called struvite. There is cysteine stones, and then certain medications actually can make stones.
That's very interesting. We'll definitely talk about that the later part of the podcast. Dr. Paul, is there anything about these stones? Why are they called radiolucent?
Yeah, so on a plain X-ray, the calcium stones will show up because calcium is radio-opaque. So they'll show up as white on an X-ray. These other stones don't have calcium, so they're basically clear on an X-ray. You won't see them on a plain X-ray. If a patient gets a CAT scan looking for stones, that will find them because that's got better resolution and to be able to see the stones.
Wow, so it's not just so some may show up on an X-ray, some may not. CAT scans, some types of stones may show up on a CAT scan. So it's really important to see somebody like Dr. Paul. That's really good information you brought up. And hey, let's talk about the first one you brought up. Let's talk about uric acid stones.
Yeah. So uric acid is the stuff that causes gout, if you've ever heard of gout, where uric acid deposits in joints. It's a breakdown product when we metabolize DNA and RNA, and that's the byproduct that comes that we put out in our urine. And if there's an excessive amount, one, patients can get gout, but secondly, they can get uric acid stones. I definitely see that. So
our friend Gary, our mutual friend Gary, we call him Gary's Old Town Tavern. His last name shall remain nameless. He has gout, and it's pretty rough, But I'll tell him, say, dude, make sure you check the kidney stones too. What are some of the dietary sources of uric acid?
Yeah, so again, it's from DNA, RNA. So gout is called the disease of gluttony. So people that eat rich meats and red wine and that sort of thing. So they always have a picture of Henry VIII, with a gouty toe,
Very goopy. Yeah.
So sources typically are animal protein, processed meats, organ meats, shrimp and shellfish. Those are the things that will increase your uric acid.
That's rich meat.
Intake that gets made to uric acid.
Is it true that shrimp and shellfish also have high cholesterol in them as well?
Yes. Yeah, absolutely. They're scavengers, right? So that's why, they're not kosher. Yes.
Okay, so stay away. Well, don't say, but just be aware of shrimp and shellfish. You got to have them once in a while.
Yeah, everything in moderation always. So
right. So what are some of the treatment for uric acid stones?
Well, the nice thing is the uric acid stones are relatively easy to treat. So first of all, uric acid is more soluble in an alkaline pH, so a high pH. So if the urine's acidic, then there's more likely that the patients are going to have uric acid stones. So the first treatment we give them is potassium citrate because that will alkalinize their urine and make the uric acid more soluble and less likely to form a stone. The other thing that we typically give is a medication that we use for gout, allopurinol, and most of the times, so I want the uric acid to be below, say, 800 milligrams in a day, 900 milligrams in a day. And when I start allopurinol, the uric acid in the urine typically will get cut almost in half. Like I'll see patients that go from 900 to 500, and then they're fine. They won't make further stones. There's a few real stingy people that the uric acid stays above goal. There's another gout medicine that's newer, that's a bit stronger, called Uloric, and that's the one that I use. There's actually a study from Stanley Goldfarb at Penn. I think we talked about him before in a previous podcast. And he says he definitely has noted that the uric acid will drop down into the normal range if you use that. So I've got a few patients on that just given allopurinol wasn't sufficient to get the uric acid to the desired range.
So for you, the listener, we were talking about alkaline and acid. So just to make it clear, most people, some people know, some people don't, that, alkaline is some of the most purest things you can put in your body, like celery, cucumbers, like Dr. Paul talks about, like citrus, like lemon or orange and water, is very alkaline for your body. And acidic foods are like the shrimp and shellfish, red meat, cheese, any type of meat, chicken, and that's very acidic on your body. So for everyone, definitely try to make the alkaline foods and sources higher than the acidic sources.
Yeah, that's what we talked about previously, the having a low protein, animal protein diet, and this is part of the reason. Because of uric acid. And what I will do is, even if patients have calcium oxalate stones, say for example, but the uric acid is high, I still will treat it, because uric acid makes sort of these like needle shaped spindly crystals in the urine, and it provides a nidus for calcium to precipitate and deposit on. So they'll say, hey, well, I don't have gout and I don't have uric acid stones. What do you give me this stuff for? And I said, well, because if the uric acid actually puts you at higher risk for the calcium stones too, because it gives somewhere for the calcium to go. And that usually makes sense to them. But that's the way that I treat them, and has been shown to decrease actually calcium oxalate, calcium hydroxyapatite stones.
That fits into what we're talking about. We're talking about prevention of kidney stones as well. So yes, Dr. Paul is living up to what he does in the medical field. Okay, Dr. Paul, that was excellent. Let's break down the second type of stone that you mentioned. Those are staghorn stones.
Yeah. So if a patient has staghorn stones, they come to me, I say, you need to go to your urologist. Okay, that's one that I don't treat, because the staghorn stones, also called struvite stones, are a result of a urinary tract infection from a particular bacteria that breaks down urea. So urea is one of the waste products in our urine, and they actually metabolize the urea. And so the urine is very alkaline in those people, pH over 8, and it causes these certain type of stones to form.
Alkaline? Okay, I thought you wanted urine with alkaline.
Well, right. So too alkaline, like we said before, too much of a good thing isn't always better. So if it's super alkaline, then that increases your risk for calcium phosphate stones. It increases your risk for, in this case, for the staghorn calculi, which is principally driven by the infection. And so what you have to do with those people is the urologist has to, and these stones are huge, like they will fill up the entire collecting system in the upper kidney there. And so the urologist has to break them up and then remove all the fragments and then treat you with antibiotics to get rid of the infection. And if they don't get rid of all the stone fragments, you have these infected stone fragments where you still have the bacteria in there, and they'll continue to make the stones. So you have to get all the stone fragments out of there and treat with antibiotics once you get the urinary tract completely cleared.
So and you're saying that they would grow to make huge stones again, as well as the bacteria.
Yeah,
that doesn't sound like a fun deal. Is there a medication used that can be dissolve the stone?
There is, and so if you've got somebody that's older, very frail, and cannot tolerate having surgery, then there is a medication that we use to help try to dissolve the stones. So I've never used it because, again, I've always referred patients to surgery, and typically that will do the trick for them.
In pre-show, right, we were talking about one issue for you, right, is when patients are diagnosed, they often have lost a lot of their kidney function.
Yeah, with the stagworm calculi, yeah. I mean, I
Yes.
even had a patient, she was so bad, she didn't know, a lot of those patients, they don't know that they have these huge stones until they're well advanced. So she actually came to attention because the stone perforated the ureter, and she was basically leaking urine out into her body, inside her body from the ruptured ureter. And she had kidney function probably in the order of about 20% normal by then. So she had lost a lot of function. So that's one of the more tragic cases that I've had. So she actually had to have kidneys removed because they couldn't get all the stuff out, and everything was so infected.
Yeah, that sounds like definitely an advanced case.
Yeah.
Okay, well, let's move on to the third type of stone that you noted, and those are cysteine stones.
Right. So cysteine is an amino acid. It's one of, there's 20 essential amino acids that we have. And these people have genetic mutation where they can't reabsorb cysteine in the urine. So when we're making urine, our bodies filter everything in there, glucose, amino acids, you name it, it goes through there. And whatever we want to keep, we'll reclaim, and whatever we want to get rid of will stay in the urine. And so they have a defect in the tubular transporter for certain amino acids, and the others don't really matter because they're all readily soluble in water. But cysteine is relatively insoluble. So they'll get these very pretty looking crystals. If you look at the urine under a microscope, you'll see these hexagonal crystals, and those hexagonal crystals kind of stack on one another and form these very hard stones. That probably one of the hardest stones density wise. So difficult to manage in that. One, to break them up is a bit formidable for the urologist, but then two, when they come to us for medical treatment. So we try our best to try to help get them to a point where the cysteine is more soluble in the urine. So a couple of things that we do there. One, again, is alkalinize the urine because it's much more soluble in an alkaline urine. And then there's some medicine called thiola, and thiola looks similar to cysteine, so it binds the cysteine, but the thiola cysteine that you have is a lot more soluble than cysteine. And so it's about 50 to 100 times more soluble. So it's a way to try to help them get rid of the cysteine in their urine without making a stone.
That is encouraging, Dr. Paul. There's a lot of treatment options they have when they see someone like you. And yeah, I imagine, I mean, you don't say, hey, I've got good news or bad news for you. You know, the good news is your urine crystals are very attractive. They're beautiful. They show great on. But the bad news is, yeah, they're binding to each other and causing crystals. So, but the good news is, though, we can treat that. So, this is also fascinating, Dr. Paul. This is amazing. Yeah, the information coming out, but it's really important, right? Everyone is different, and they've got to see a professional.
Yeah. Well, and the nice thing is, for the cysteine stones, when I send it to the lab I like to use, if it's the first time that patient has ever had their urine analyzed, they'll actually do a cysteine screen. And they'll report their cysteine negative, or if they say cysteine positive, which I've never had, then clearly I'll have to work them up and quantify the cysteine that's in there to treat them. But that's a nice thing about that lab, that's something I typically wouldn't miss, where patients will have these stones. I'm like, what's going on? Everything's normal in the urine. And it's like, no, because they have cysteine in there. So that's what's causing the stones.
Wow. All right. So we've worked our way through. We're going through the stones, and I think another way that someone can manufacture stones is through medication itself. Is that true, Dr. Paul?
Yes. So I've only had one of these in all the patients that I've treated. The most common that's mentioned in the literature is what I saw. A patient had a stone made of a medication called triamterene, Triamterine's a diuretic that's used for high blood pressure. So it's in a combination medicine often called diazide. That's the old school name for it. It's been around so long, it's a generic now. And the only way I could figure that out, because clearly when I'm doing the 24-hour urine, they're not measuring for triamterene. So they'll actually send the stone fragment. This is an important reason to have your stone sent for analysis. And the stone fragment analysis came back and said, this is a triamterene stone. I was like, holy cow, that's why this guy's making stones. It's from the medication. So we stopped the triamterene and they quit making stones. So that was an interesting one that I've had. The other medicine that you'll see that's affiliated with stones is something that's used to treat HIV, called tenofovir. And so that one I have not seen, but it is certainly described in the literature where that one can cause stones as well.
That is something to think about. And, well, Dr. Paul, I think we've covered what we need to cover today. We want to thank you, the listener, for once again tuning in. And Dr. Paul, yeah, we know we put it on the cover and some of our messages in the podcast, but what is your website that they can visit?
So website is www.kspfla.com.
Sounds like a radio station.
WKRP in Cincinnati.
Yeah, maybe if you ever wondered what happened to me. So
Les Nessman. All right.
Yes, all right. Well, thank you so much, Dr. Paul, as usual. Fantastic. A lot of information, but as Dr. Paul says, make sure you see someone like Dr. Paul, because every case is different. So once again, thanks everybody for listening, and we will see you next time on the podcast. Thank you.
Will, thank you so much. Appreciate you.
Thank you, Dr. Paul, for joining us. Once again, you can reach Dr. Paul with any questions at www.kspfla.com or at 239-221-1281, the Kidney Stone Prevention Clinic of Orlando. Until next time, folks.